Topic is Peau D Orange. Hello dear students, we'll discuss a clinical sign today in a breast lump. Just have a look. See that nipple is there, areola is here. You can see that dot, multiple small dot like orange peel. See that entire breast skin is involved. This is called as Peau D Orange. It is due to carcinoma infiltrating the dermal lymphatics. So lymphedema occurs in the cutaneous skin dermal component. So sebaceous gland opening and hair follicle opening will get looks like as if those ordinary openings get buried there, looks like orange peeling. It is the cutaneous manifestations of carcinoma breast. Sometimes we use lens to see properly, which is here it is visible, very clearly it is visible. See that all these dots are typical orange peeling. With the magnifying lens if we use, we will be able to appreciate it better. So this is the Peau D Orange breast cutaneous lymphatic edema. Carcinoma breast is the most common cause, remember here. Other causes also may be there, tuberculosis, lymphedema also. Lymphedema of the breast filarial, it's very common in this country, especially in the coastal region. That also can cause, but first thing comes in the mind is carcinoma breast. Cutaneous lymphatic edema occurs due to obstruction of suddenly subdermal lymphatics by lymphatic permeation. Method is permeation, remember there are two types, lymphatic permeation and lymphatic direct spread. So, which is the permeation one, permeation and embolization. Permeation is it passes through, they proliferate through the lymphatics. Embolization dislodges and flows in the lymphatics. Permeation is entire lymphatic vessel is involved. Whereas embolism, the lymph contains the malignant cells. So it's the lymphatic permeation, lymphatic embolization is a different area, different embolization occurs. Also very characteristic of inflammatory carcinoma of the breast, very typically seen in the inflammatory carcinoma, but can be seen in other parts, other areas also. So other causes are chronic breast abscess, lymphedema, I already told filarial lymphedema. Mammography, ultrasonic breast followed by true cut biopsy is the ideal investigation. Of course, you have to do a CT imaging, CT abdomen, CT chest, maybe PET CT to see entire system, and then you have to plan and stage the disease. Molecular biology, you have to check ERPR, HER2 status with the Ki-67. Then you decide what to do, mastectomy or MRM. We can't do any breast conservative surgery or give new adjuvant, then go for MRM, then give a chemotherapy, then give a hormone therapy. It's a very aggressive malignancy as such. So it's a typical clinical sign you have to remember, Peau D Orange as such. So Peau D Orange appearance of skin in carcinoma is due to intraepithelial tumor, carcinoma in situ, vascular invasion, lymphatic permeation. Put the right answer in the comment box. I will get the answer later. Students, please. So students, I hope you understood this clinical sign, Peau D Orange, meaning and methodology very well. Thank you so much. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics including briefly trauma, how to approach orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery, entire thing clinical method with a lot of photos, illustrations, each condition's photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis. But it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail, principle of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topics, general surgery, endocrine, surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and consultant, coming consultant also, with the illustrations, photos, a few video lectures and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there, covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very, very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast, and other things, include briefly gynecology surgeries, with step-by-step illustration photos, more than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that. In detail, explanations are there. My small atlas of tissue approximation with the videos shows clearly, with the principles, how to suture tissues. Dissection and tissue approximation, the two parts in surgery. Dissection is a principle, essential. After this surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that. Very, very useful thing for to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram and so on. My DigiNow lectures to the JP Publisher covers around 220 lectures in detail as far as CBME syllabus, general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topic, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, the examination, clinical examination videos also. It covers 220 lectures, covers everything. 1 year purchase you can do. It gives detailed thing about explanations with the wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, with including DigiNow and lectures. Thank you very much.